Hello everyone, welcome to Head Info channel, and today video we will talk about flu disease. Let's see what we have in this video. In this video, we will talk about the general information about the influenza, the causes and its complications, as well as we will help you answer the question like what is flu symptoms and how different from COVID-19, a pandemic of the world now, or which medicines that are used to treat flu. Now, let's begin. The flu or influenza is a viral respiratory infection. For most people, the flu will go away on its own, but sometimes the flu and its complications can be so severe that it can be deadly, and COVID-19 is an example. Let's see the complications of the influenza. In young people, like I said before, the flu usually goes away on its own after a few days without treatment, and the disease leaves no complication. However, in some susceptible ones, the disease may progress to pneumonia, to cardiovascular problems, to bronchitis or asthma flare-ups. Sometimes they may cause air infections. And who are usually at high risk for flu complications? The people are patients under 5 years old, especially for children under 2 years old, and people who are over 16 years old. Patients with chronic disease like pulmonary, renal, hepatic, hematologic, cardiovascular, except isolated hypertension or metabolic disease, including asthma, diabetes, and sickle cell disease. High-risk people also include people who have a neurological disease like diseases related to nerve development, including epilepsy, stroke, spinal cord injury, and muscular dystrophy. People who have immunosuppression also susceptible to have complications when they have a flu. Children and adults under 18 who are taking aspirin or other salicylate-containing medicine, or pregnant women and with postpartum, are American Indians and Alaska Native, or patients in nursing home or indeed on ongoing care, are also high-risk people. People who have obesity also have a higher risk to have complications when they have a flu. The onset of flu symptoms is similar to a common cold with runny nose, sneezing, and sore throat, but the common cold usually develops slowly, while the flu tends to appear suddenly. Popular signs and symptoms of the flu include stuffy nose, fatigue and weakness, or fever over 38 degrees Celsius. Muscle ache, headache, sore throat, dry and persistent cough, chills, and sweating. Don't you know influenza is caused by viruses which are transmitted through the air through contact with droplets from an infected person, or the virus can also be spread by contact with the object of the infected person. How to distinguish between flu and COVID-19? Influenza or flu and COVID-19 are both infectious respiratory disease. The difference between that they are caused by a different viruses. COVID-19 is caused by infection with a new type of coronavirus called SARS-CoV-2, and flu is caused by infection with the influenza virus. Because some of the symptoms of flu and COVID-19 are similar, it can be difficult to tell the difference between them based on symptoms alone, and testing may be needed to help confirm the diagnosis. Influenza and COVID-19 share many characteristics, but there are some key differences between two you can see in this table. While both flu and COVID-19 have a fever and dry cough, people who have a flu may not experience warm breakfast, while COVID-19 people usually have a breakfast. For COVID-19 people, it's rarely to have a headache, and they may sometimes have a sore throat or body ache, but headache, body ache, and sore throat are popular symptoms of flu, and are very significant symptoms of COVID-19 itching and loss of taste. While for people who have flu, they do not have any change or loss of taste. Of course, this is simple comparison. Now there are many COVID-19 variants, and each variant has their own symptoms. We will have another video to analyze about this topic. About the treatment of influenza. Usually the flu goes away on its own after a few days, but if you have a severe infection or are at higher risk for complications, an antiviral medication such as oseltamivir or Tamiflu, zanamivir, Relenza, peramivir, Rabipur, or paloxavir, sulfuza. These drugs can shorten the duration of the illness by about a day and help prevent serious complications. Oseltamivir is an oral medication, while zanamivir is inhaled through a device similar to an asthma inhaler, and should not be used by anyone with certain chronic breathing problems such as asthma or lung disease. Peramivir or paloxavir are antiviral drugs, and the side effects of antiviral drugs can include nausea and vomiting. These side effects can be reduced if the medicine is taken with food. That's all information about the influenza or the flu. Thank you for listening, and like, share, and subscribe for Head Info channel if you like this video. Thank you so much. See you again soon. Bye bye.